According to the research of David M. Clark from the Department of Psychiatry, Warneford Hospital in the University of Oxford, anxiety disorders are characterized by distorted beliefs about the dangerousness of certain situations and/or internal stimuli. David Clark named 6 processes that could maintain anxiety-related negative beliefs, namely: Number 1. Safety-seeking behavior. This was defined by Salskovskis as a behavior which is performed in order to prevent or minimize feared catastrophe. Patients with this anxiety continue to think they might die in a panic attack because every time they have panic attacks, they sit down, rest, slow down their breathing, or engage in some other safety-seeking behavior and believe erroneously that performing the behavior is the only reason they did not die. Number 2. Attentional deployment. Patients with this anxiety had a large number of medical investigations which have indicated that they do not have physical illness they are afraid of, but they are not convinced.
I have! Help me!
You don't have any illness, ma'am!
Help me!
Number 3. Spontaneous imagery. Patients with this kind of anxiety saw images and come to realize their fears. Number 4. Emotional reasoning. Patients with this kind of anxiety tend to do many things that others need to see or want to see. People with this kind of anxiety wants to be impressed and be accepted by other people in the society. Number 5. Memory processes. Patients with this kind of anxiety often have difficulty in intentional retrieving a complete memory of the traumatic event. This is also called as pre-traumatic stress disorder or PTSD, and their intentional recollection is fragmented. Details may be missing and they have difficulty recollecting the temporal order of evidence. And there comes the nature of the perceived threat. Persons with this kind of anxiety has selective retrieval of negative memories and impressions of the observable self. Tendency for anxious individuals with this anxiety has selective retrieve information which appears to confirm their worst fears. Empirically derived treatment. It is a maintenance process to develop a particular approach to the cognitive treatment of anxiety disorders. Number 1. Treatment for panic disorders. Therapists conduct an experiment wherein they start develop with patients an idiosyncratic version of the cognitive model. The treatment that was developed first and therefore has been most extensively evaluated is cognitive therapy for panic disorder. Immediate post-treatment response is superior to no treatment, supportive psychotherapy, applied relaxation, and imipramine. Number 2. For hypochondriasis. Anxiety disorder patients always have reasons for believing that the things they fear are dangerous, however strange the fears may seem. The therapist, therefore, tries to get inside the patient's head and see what the evidence is. An anxiety disorder patient's beliefs about the dangerousness of feared stimuli are generally mistaken. Patients have often experienced a number of events that contradict their beliefs before they come into the therapy. Number 3. For social phobia and PSTD, the only treatment is exposure. Exposure is only one of many behavioral experiments that are utilized in cognitive therapy. Exposure assignment helped her to discover the reality. Contrary to her prediction, she was acceptable even without her frantic attempts of self-presentation.
Love was true, but it's now become a lie. So I'm telling